This show is for entertainment purposes only. Do not mistake this show for medical advice. If you or anyone you know is in need of a dentist, please contact 480-391-0099 to set up an appointment.
Welcome to our podcast. Sit back and relax. Dental Works Podcast. We're gonna share some facts. We gonna raise your dental IQ at the Dental Works Podcast. We will guide you. Put out some bad jokes before we are through. Free information here just for you. Sit back and have a good time.
Today is April 15th, 2023, and this is episode number 118 of the Dental Works Podcast, the show about learning the ins and outs of dentistry from a patient's perspective. I'm Ted Work, and that over there is Dr. Terry Work.
Hello, Ted.
Sorry, I just got a text message. Dental Works is a family dental practice based in Scottsdale, Arizona that has been providing cosmetic and surgical dentistry for over 27 and a half years.
27 and a half. The half is the most important part.
But over that is what I'm saying. It's over that amount.
When can we start saying 28?
Well, no, we'll
been a long
probably
time.
go up to 30 once the 30.
Yeah. It's getting close.
We'll probably
Jesus. Been married 35 years almost.
Yeah.
Whoa. Your mom felt compelled to go ahead and buy herself a customization of her wedding ring.
Okay.
Yeah.
What'd you get? Like,
She got extra frickin' diamonds. She just had somebody throw
They
a
just
shitload
throw more
of diamonds on there. And then I'm like, well, okay,
Nice.
so what do I get for my 35? She goes, you get me. I feel shortchanged. I think she
you
always
could
starts
just buy,
that whole
you could
thing.
buy yourself a thing and
She
be like,
does
I got
that whole
myself
thing. She does that whole thing. Oh God, I saved you so much money. Really? Did you save me as much money by like not doing it?
Hey, you know what? I bought myself an
I tucked
anniversary PRS. It's one of those dragon ones that are $40,000.
I convinced this jeweler to modify my ring and then pay me to do it. Yeah, that's
All right. Well, that sounds like a good old time, like a rip-roaring
whatever.
fun fest.
No.
Anyway, I started up my Dungeons and Dragons group again. It's very fun. It's very fun. All of the people, they were getting really into their characters, and guess what?
They all died.
They got captured, and now they had to make all new They had to make all new characters and figure out what happened to their old.
Oh, okay.
Are they alive? Are they dead? Nobody watches this show. I'm going to spoil it. They're all alive. It's all good.
None of your friends watch
They could
this
probably
show.
rescue them. It's all right. Anyway,
Aren't you the dungeon master?
I am the dungeon
Oh,
master.
God. Is that like a big frickin' like power trip, kind of?
No, honestly, my favorite thing to do is like when people are they're constantly talking about like, oh, that would be funny if this happens or whatever, and like taking that as a suggestion for what would happen in the future, and like
Seeing if they remember
like, the
having-
goofiest bullshit ever. It's so much
Seeing if they remember having mentioned that. Like,
yeah, and
all
also
the
like
time
bringing back a character from like 3 years ago at the very beginning and being like, he was actually really important. That's part of my favorite thing. Anyway, you good? You good? That seemed
That was
dramatic.
close. That was close. This is black
Well,
and it's
you
invisible.
know what?
You know, I know.
If you spill coffee on that stand, I won't care because that thing deserves.
We're getting rid of it. We're getting a new stand today.
We're gonna film a
Dizzle.
video. We're gonna film a video of us beating
Blowing
up
it
the
up.
stand like in Office Space.
I'm going to get my AR-15.
Okay,
and we are
that's
gonna,
a little much.
No,
That's a little
44
much.
mag.
Do you have a
You're right.
sledgehammer? We
You're
could do
right.
a sledgehammer.
Hey, when you're a hammer, everything's a nail.
Anyway, we're going to move on to our main topic
Yes,
today.
which is timely.
It's very interesting. I kind of came up with this idea in my head Because that's where all
because
ideas
that's where
kind of
all
hap-
ideas
kind of happen.
originated. I don't know.
But
The toenail ideas did not really work as well.
different types of procedures here at the dental office have different amounts of times or healing timelines, I like to call it. 'Cause
Well,
that sounds
so let's back up
multiversy.
just a minute. And the part of the reason we chatted about this, and we talk about in pre-production, we talk about subjects that are timely.
Ooh,
that work
fancy
on
pre-production.
pre-production. So I talked to my producer, and we talk about things, and this just happens to be timely because a good friend of mine who lives in Atlanta, Georgia, called me. His daughter went in and had an X-ray done. They found what's called a periapical radiolucency, and all that means is a big dark spot on the end of an X-ray. And I'm gonna force you to learn something here. A dark spot on an X-ray means that area has no bone in it, or it has very low amount of density.
Okay.
So it's backwards from kind of what you think. So anything on an X-ray that's white has very high density, like
Right.
bone, teeth, that kind of stuff.
Sure.
And anything that's dark has very low density. And the reason it is because the way X-rays work, X-ray source shoots X-rays through your body and hits a film.
Right.
And so if the density is very low, then lots of X-rays make it through that area,
Right.
and hit the X-ray film. So it'll show
Less
up.
stuff to block the X-rays.
Exactly. And anything that is white, it means that portion of the film was not exposed, or was not
As exposed.
was not excited by the X-rays
Right,
hitting it.
sure.
So there was no activity.
Right.
So the whole film starts out black.
Okay.
The whole film starts out white, I mean.
That's what you meant, right?
Right. The whole film starts out white, and the X-rays going through your body turns the X-ray film black wherever there's no resistance.
Sure.
So,
well, nowadays that's just, we understand that it could be any color because it's all digital now.
Right.
Like it
doesn't have to be
that's how
black
it
and
can-
white,
right,
but
yes.
most people are familiar with an X-ray.
They still use that because it's like, why change the colors? Like you still read it the same way.
Right. So, but yeah, and with the software we have, we can change to,
Sure.
because we use it a lot
Sepia.
different. We have a CBCT, which is a cone beam scanner, which does that same thing, but the software is so powerful that it can interpret it three-dimensionally. And so the computers are so fast, the refresh rates are so good that you can interpret it kind of on the fly and like take an X-ray, a three-dimensional X-ray of someone's skull, spin it around in 3 dimensions and see it from all different angles, which, again, it's already too late to make a long story short. But my friend's daughter had a radiolucency at the top of one of her teeth. I won't give you her name because I don't want to embarrass her, but lovely gal. However, the dentist made a recommendation, and then I get, when you're a dentist, you get calls from either relatives or friends or whatever. Oh,
Right. I know this.
And then they say, well, can we fly her over to you and you do it? And I'm like, well, that sounds like a blast. I'm going to do surgery on you and then keep you at my house and watch you swell and have these. I mean, it's not the best vacation for her because she should kind of recoup in her own environment.
Right.
And secondly, she's only going to be here for a week. So if she comes and I do the procedure, usually what I'll do is a 1-week follow-up. That's typical. I do a 1-week follow-up to follow how she's healing.
Right.
The problem is the way I do bone grafts, which is what she needs, I draw blood, I mix it in with other products, and we relieve her of the tooth, and we put it in there. Well, finding a dentist in her area that does the procedure that way, it's hard for me to do. I don't know any dentists. She lives in Nashville. And so anyway, the whole
trying
point
to narrow
is
down who this is.
I can't
figure it out.
The whole issue, it's Taylor Swift.
Oh.
No, I'm just kidding. So the whole thing about this is the subject's going to be healing times for different procedures.
Right.
And And the biggest thing that you need to know is like gum tissue heals faster than bone.
Right.
And one of the things we want to do if we want bone to heal, we definitely don't want gum tissue to grow in there.
Okay.
And so
Right.
we have to do all sorts of different follow-up things depending on the
Interesting.
procedure. So I'm sorry.
Gotcha.
I cut you off.
No,
but go ahead.
that's totally fine. Basically, what we're going to be talking about is we've kind of already talked about it, but what sorts of timelines or healing? The timeline is the word I'm thinking.
Right,
Of.
yeah.
But what sort of timelines are we looking at for different types of
Right.
procedures? Like
So-
what procedures don't need anything? What is just like a week follow up? What are you like? There are things that are fairly traumatic to the mouth, and so you need to kind
Right.
of do those sorts of follow ups. But kind of
Right.
talk about maybe a short range as compared to a long range. healing
Well,
timeline.
so I mean, the best way to split it up is hard and soft tissue. If it's
Okay.
something that's just the gum tissue and it doesn't involve any bone,
Right.
then you would have a shorter healing time.
Yeah.
And you would expect different things. So let's take,
Sure.
for example, someone will come in and they have gum disease, and we have to do a procedure just on their gums. Say their gums are infected and they've swollen up, and we need to do, say, laser therapy, which only includes the gum tissue. Get you numb, keep you comfortable, do the laser. You laser down to shrink the tissue a little bit, bring them in for a 1-week follow-up, and that's typically all you need. However, there can be periodontal diseases that have started to affect the bone. Well, periodontal disease by definition has already affected the bone a little bit, but sometimes it affects the bone so much that you don't just work on the soft tissue, the gum tissue. Sometimes you have to go in and contour the bone underneath.
Yeah.
And if you have to do that, then the healing process takes longer.
Gotcha.
So I would expect maybe 2 follow-up appointments on something like that.
But so what? Let's take an example procedure. Let's say getting one implant placed.
Sure.
I know that one's a little bit different because you're kind of waiting for structural support and structural
Right.
strength to
Right.
kind of build itself, grow in there, and you're waiting
Right.
for that to then go.
But
into the
that's a
next
really
stage,
good
but-
that's a really good point, because you would not place an implant in an area where there was any infection.
Yeah.
However, some of the other procedures we do are to help get rid of infections.
Yeah.
So with an implant, typically, and there's all sorts of different kinds. Sometimes you do the procedure with minimal invasion to the soft tissue, which is known as a punch technique, where there are no stitches at all.
Yeah.
You do a procedure. We just did a couple of those last week, and actually Kristen videotaped some of them. So those
yeah.
will be coming out on our
Is
website.
she squeamish at all? Was she able to do it?
She said she had to look away a couple times, but she did great. She was great. And the
Awesome.
patient was awesome, and it was great. But so for this gentleman, we did it, I want to say it was on Wednesday. So he'll come in for a 1-week follow-up. So basically, he has a missing space. He actually is missing 2 teeth. We put 2 implants in on Wednesday.
Mm-hmm.
He'll come back a week later. We'll make sure everything looks good, which typically it does. And then in about 2 months, we can put teeth on those implants. See, people get confused. They think the implant is the tooth. There's 3 parts, and we've talked about this. There's 3 parts to an actual implant restoration.
In the future, we'll do an implants revisited so
Okay,
that we
that's
can
fine.
kind of talk about it. But I have a few of them kind of
Okay.
coming up, and we'll
Okay.
do some advances in implants because I love doing those, and I like listening back to our old episodes
to
and
kind of
do that.
see,
That's
yeah.
fun.
But in his particular case, he'll come back after 1 week. Everything should look good. Then we'll reappoint him for further treatment down the road.
Yeah.
The main thing is we're just making sure that it's healing the way I expect it to look.
Sure.
If there is any tissue that's infected, we might, and typically after something like that, you'll be on what's called Pyridex rinse, which is just like a chlorhexidine rinse. It's an antibacterial agent, which is really good because you rinse with it, it kills bacteria. You don't have to take a pill that messes up your whole
Sure.
digestive tract.
Sure.
So yeah, on an implant, it can be quite simple, but at that 1 week period, if things are going every once in a while, very rarely, and I would say that in our practice, we have about 95% success, 97% success rate in the lower arch, about a 93% success rate with implants on the upper arch.
Yeah.
And that's not true for every practice.
Sure.
Some of them,
Well, you have to think about that number as factoring in all of the implants you decided not to do because it didn't seem like the right setting or environment.
Well,
to do
some
those,
people,
right?
some people are just not good candidates.
Sure.
For that, and we'll
Right.
talk about that. And one of the things is, we alluded to last time we did that "Are you too cool for school" episode where I answer questions about infections and the person had diabetes.
Yeah.
You have to measure all that. Now, it doesn't mean they can't get an implant. Just because someone smokes or has diabetes.
Wilfred Brimley? Oh my gosh! Special guest Wilfred Brimley's on the show today. You guys.
It doesn't mean you can't get an implant. It just you have to manage it a little bit differently. Yeah.
Sure.
And so that's all part of clinical judgment, being able to tell. And in medicine, no matter. You can do everything 100% right and still have things that are unpredictable.
On this episode of Clinical Judgment.
Yes.
All right, here we go. I'm curious what is the longest healing timeline that you come across? Like what? Full mouth restoration, all on fours. Like what's the healing timeline for like a full mouth restoration?
Well, full mouth restorations. You don't do those unless they're healthy. So
Sure.
The longest thing we do is a bone graft.
Yeah.
And there's lots of different types of bone grafts.
Yeah.
There's grafts where you're just filling in an extraction site.
Yeah.
There's grafts where you're lifting the person's sinus.
Sure.
There's grafts where you're taking a piece of bone from one area on their body and moving it to another area.
Mm-hmm.
So basically with the whole idea that we're grafting in order to put an implant in there later. And so if you don't manage those sites properly, like if you do what's called a block graft, is you take a block of bone and you place it in an area and you secure it with securing screws, basically. Like somebody blows their knee out or tears their whatever, they get screws or plates in their
Sure.
arm. They break their arm and you hear someone say, "Oh, I got plates in my arms with 9 screws or whatever." Those
Sure.
screws we use in dentistry as well. You screw the block in place and then you let that heal. If you don't let it heal sufficiently, when you go to place the implant, the block will split off, and that's a bad.
Yeah.
So that's where you're like, you don't want to rush that. You want to make sure
Yeah.
they heal, and you follow their healing with CT scans and make sure they're ready.
And so does that bone fully integrate? Like
Yeah.
it gains vasculature and it
Right.
kind
So
of really...
right. So there's a couple different ways. There's what's called an autogenous graft, where you take the bone from the person
Okay.
and you
Now, do you do that?
Yes.
You pull the bone, but it's usually in the mouth.
Yeah,
You're not
it's-
pull, you're
no.
not you're not cutting here.
I pointed to my arm or my hip.
Yeah,
or what, no. There's no. So, I've actually assisted on surgeries where we was with an oral surgeon one time, and we did a graft where he took a piece of the patient's hip,
Yeah.
and repaired the roof of her mouth. She was
Wow.
cleft lip, cleft palate.
Wow,
Took
sure.
a piece from her hip. And he told me, he said, she's going to be more sore. This was down in Mexico. He said her hip is going to be more sore than her mouth.
Yeah.
Yeah.
I've heard that the best graft is shin bones.
Shin bone graft. Okay, don't touch your microphone stand. I got yelled at for that. You better leave that in. Leave it in. So
Edit
anyway,
point.
The whole point is doing the procedure properly and not getting in a hurry,
Yeah.
because the patient will, they'll say, "Oh, I know most people take 6 months to heal, but I'm special. You can probably do it in 3 for me."
I'm gonna eat Captain Crunch every day.
And it's interesting because we just had a patient that came in. One of the patients we placed some implants in last week, we had done block grafts. And again, I'm backing up. There's autogenous grafts, but then there's people that donate their bodies to science.
Yes.
And they'll take the bone from their hip.
Right.
And they cut them up, and they're called J blocks.
Right.
And a J block is a piece of iliac bone, and they rinse it with all sorts of different chemicals to make sure it doesn't have any bacteria or anything.
Yeah.
They run it through a process, and then I use that bone to graft.
Now, is that
And so-
essentially just like a like a porous scaffolding of bone, or is it
like if you look at a T-bone steak has a bone in it?
sure?
And it looks kind of like that. One side will have the trabecular bone, which is the soft bone, and then the other side,
the inside,
right?
okay,
The inside is
gotcha.
all trabecular and kind of
Gotcha,
spongy
okay.
looking. The outside is called cancellous bone,
Yeah.
so it's real thick and hard.
Yeah.
So you want both of those because
Interesting.
you prep the site and then you put the graft on there and then
Yeah.
you screw it into place.
Man, we're gonna do the
And
fake
you-
bone revisited soon too.
Yeah.
We should do a stretch of a bunch of revisited.
Yeah,
episodes.
and so, but the thing is, if you use the patient's own bone, it works way faster.
Own bone.
It works better, and it shrinks less. If you use bone from someone that donated it,
J-bone.
that J-block,
J-block.
that J-block will shrink a lot more. There'll be
Okay.
less bone to work with.
Yeah.
But eventually, it will all turn into their own bone.
Interesting.
Eventually, because
Interesting.
and that's where we use blood. And getting back to the original story about the friend of mine who needs a graft, that's why I want this patient to go to somebody that draws blood
Yeah.
and does a graft with the blood products because it heals faster.
Yeah.
It swells less.
Sure.
And it hurts less.
Yeah, I bet.
So
yeah.
it's a I've been doing it for
And it's
7,
a-
8, 9 years.
It's a
and-
pretty fairly new technique.
I mean, it's not that new. It's just that they've made it
Implementing
so easy to implement into your practice. There's
Yeah.
almost no reason not to.
Sure.
I mean, a general dentist, again, I'm a general dentist. I'm not an oral surgeon. I've just taken on the training.
Not a corporal dentist
Corporal.
or like a captain
No.
dentist at all. Okay, gotcha.
Admiral.
sorry.
Admiral
dentist.
dentist.
Admiral dentist.
Admiral dentist.
That's the
So-
name of this episode. Is Admiral, dentist. I think.
So you incorporate things into your practice that make you a better dentist or whatever. And so we started doing that, I remember 7, 8, 9 years ago. And it just helps. On the 1 week post-op, my patients are just so much happier than they were before we started doing this.
Yeah.
And I've trained my staff. They've gone to phlebotomy school and learned how to draw blood. Phlebotomisms. And they learned how to draw blood and how to spin it down. You use a centrifuge
Yeah.
and you spin it down. And it's infinitely interesting if you're a dentist, and it just sounds creepy if you're not a dentist. And what most people would know is think of Kim Kardashian and the vampire facial.
Sure, it's similar kind of a deal.
Yeah, exactly.
They're basically just separating out all the.
healing product from your blood, and they just, I don't know what they do, smear it on her face, or they
They use a bloodletting kit.
Well, they use these little rollers with little needles, and then they micro needle your face, and then they smear that stuff. It sounds awesome. Anyway, we don't do that here. We do Botox. Though.
What? All right, we do not have a manual face lawnmower with the vampire whatever you're talking about. And with that, we're going to move on to our favorite segment, which is Celebrity Smiles. If you're interested in checking out these images, please watch us on the YouTube channel.
On the
T-Door
YouTube?
Productions, T-Door
On the
Productions.
computer?
On the
internet.
YouTube channel.
Okay.
The YouTubes. I didn't have a theme for this one. I just kind of there's a website that gives you random celebrities. So here we go. First person
Okay.
is one Emma Thompson. You know who Emma Thompson is? She's a very bland lady
Emma Thompson.
doing she's in all
British
the British
actress.
stuff, something British.
Emma Thompson. She's cute.
She's British, so this should be fun.
We use the British scoring system.
No,
where
you know what?
Everything is in
I think after
kilometers.
Brexit- I think
is
after-
in aluminium.
We measured their teeth in stone.
She's got nice teeth. She's got what it's known as lapped laterals, but a cute smile. She's cute.
Oh.
She's very Mary Poppins. She got a PFM crown on number
I thought you were going to say PF
15.
Chang's.
She's got a PF Chang's. She needs her teeth straightened, and her teeth are a 6.
A 6.
But a
Wow.
7 on the British scale.
But a 7 on the British scale. Is it just +1 or is each number a different translation?
It depends on how I
Just
feel.
different?
Yeah, it just depends on how I'm feeling.
Gotcha.
If I'm mad at somebody who's British, then the scoring is different.
All right. Well, let's. This person's quite possibly the least British person. You know what? I don't know. I'm just going to tell you who it is. It's William Shatner. Bill Shatner.
Didn't he just turn like 95 or something?
I don't know. He he's too old. I think he's too old. I think that's what it is.
William Shatner teeth.
He's gonna live to see Star Trek. Yeah, no, he's. I mean,
that's best.
We gotta rewatch the original series because it's so.
Oh my god,
it's so rough. You watch the people in the background, and there's like. You can see like somebody made like a control panel out of old egg cartons, and there's a guy with a wrench, and he's not even like touching it. He's just doing.
Well,
busy
that's
work
kind
on
of the joke
spaceship.
from Austin Powers is you can stay guy turning wrenches and not doing his
Making
teeth
it look
are
like
pretty
you're doing
bad.
something.
His teeth are pretty bad. I'm going to give him a
goof
4.
Yeah.
I like him
4.
though.
Do
if he
you,
was
though?
British,
Do
it would
you?
be a -7.
Why do you like him?
No,
Is it
I don't
because
know.
the
He's had a rough life.
has he though? Has he? He's quite possibly one of the most recognized people in the world.
Look how handsome he was. But his teeth are always pretty jacked up.
Yeah,
What'd I
he
say, a
smoked
4?
a lot, right?
Oh.
Okay, he has to have smoked a lot.
Okay, the worst thing about Star Trek, Leonard Nimoy's record albums.
Bilbo. Do you know that one?
No.
That's funny.
Okay,
All right.
who's the last?
The final person. If I had to think of a celebrity, and it would take me 1,000,000 years to come up with this person.
Okay.
This person's name is Brad Paisley. There are a lot of celebrities. Sometimes you forget which ones there are.
Is he
Do you know who Brad Paisley is?
is he a singer?
He's a country music guy. He always wears a hat.
I have a hat. So he is
We're not
So,
doing much camera B.
he's got a
action this
real
time.
big nose.
What? Does it? You got to have teeth.
So
that
he's
balance it out?
so one of the things about people with large noses, and I'm not picking on him,
Right.
is that a lot of times their nose meat pushes down their upper lip, and so they have
new band name knows me.
nose meat. They have kind of a distinctive look where their
Yeah.
lip kind of covers up. Their nose is big, and it doesn't allow when they smile their lip to come up and show stuff.
Gotcha.
So it's kind of the opposite of too much gooms. He's got nice teeth. I'm going to give him a 7. He's got a nice friggin' hat.
You know the guy. You know the boss in The Incredibles.
Yeah.
You know how he's got like 15 inches between his mouth and his nose. You
Yeah.
know what I mean? So it's the
Yeah.
opposite of that. Is what
Yeah,
you're
but
saying.
if you look at what I'm talking about.
yeah.
But I mean, he's a handsome guy. He's
He's got a
what did I
pointy
say?
nose.
What did I say?
I don't remember. So you could come up with anything. I could
A
do it in post,
7.
but I'm not going to. 7? That's not bad.
Let's look at it and see.
That's not bad.
Okay.
Do you like Brad Paisley's music? I, for the life of me, could not say a single song
can't
or
either.
listen to. I
I-
like the
I'm not a-
pattern Paisley.
I'm not a huge Brad Paisley song.
Oh, are we going to listen to it?
No, we're
See if we recognize
We're
the
gonna
names of
see Whiskey Lullaby so far.
No idea. Nothing.
She's everything.
That
Remind
sounds
me,
like-
I'm gonna miss her when I get where I'm going. That's it.
I got
He didn't have to
nothing.
be waiting on a woman. And then there's one just named Alcohol. I like him. The most recent remind me.
It's on brand. It seems like it's on brand. You want
We
to play
danced.
a song or
Yeah, sure.
play something? Are you
how
on
about this
Spotify?
one?
Pull it up on Spotify.
I'm still a guy. How about that one? Let's
I
see.
mean, you do whatever, but it's do whatever song. I just want to see if I do the top one. The top one when you pull them up on Spotify.
Brad Paisley, artist. Whiskey Lullaby. Okay, Mud on the Tires.
I know he's a
Okay,
guitar man.
Whiskey Lullaby has 224 million downloads.
Well, plays. All right, that's enough of this. It's exactly the type of music I thought it was.
He's got a great voice.
He's good. You got to get the shit. I think that's enough of that. I can't put this on YouTube. This is all getting cut out. It's going to flag us, and I can't do it. That's why
Okay.
I want to say that. But
Well,
I
at
just wanted
least
to
you
see-
didn't yell
well,
at me.
I just wanted to hear what it sounded like, see if I could recognize it.
Okay.
And I can't.
No.
Because it all sounds exactly the same.
So we went to a happy hour last night
Yeah.
at the apartment that we live in.
Okay.
Which actually we just bought a condominium. We're moving out of our apartment, climbing down the
Yeah,
ladder of
I'm
success.
moving in with them.
Anyway,
We're
I
getting it
can hardly
going.
wait.
It's
So
gonna be
we'll
great.
be doing all of our video podcasts from our apartment bathroom.
Do you-
No, anyway, so we're sitting there and there's a band playing.
Yeah.
We're in an apartment complex where the average age is 97. And there's a
Yeah, you
guy,
guys are the young
drummer.
whippersnappers.
It was so funny because there's a guy playing keyboards and it looked like his son playing drums. And the songs they were playing, I mean, the drummer, he was like yawning while he was playing.
Yeah.
It was really bad. But I was just like, going, check out the drummer, man. And I said, I wish Ted was here to give commentary
Yeah.
on what the drummer is thinking while he's playing. And I'm not kidding you. There was people dancing that were in their 90s. It was
Wow.
crazy. But yeah, we're getting the hell out of
That's
Dodge.
kind of the curse of the drummer.
I was thinking of writing a country song while I was there watching them, and my country song was called Heaven's
to Betsy.
Waiting Room. Heaven's Waiting Room. Heaven's to Betsy. No.
That could be a good song. You can make a parody.
Heavens
like
to Betsy. No, it was Heaven's Waiting Room.
the way it's spelled is heavens and then in parentheses to Betsy.
That's good.
I think with that, we're going to say thank you for listening to the Dental Works podcast. If you'd like to support the show, please give us a rating on iTunes or your podcast player of choice. I don't know how much that helps. Just listen to the show. Try and tell your friends about it. Cry and tell your friends about it.
Crying to Betsy. Tell Betsy.
If you'd like to get in contact with the show or you have questions, please send an email to dentalworkspodcast@gmail.com. We may talk about your question on the show. If you're located in the Phoenix
We
area.
would love to talk about your question on the show. So.
Yes, no, you're total. If you're in the Phoenix area and you need dental work, please give us a call at 480-391-0099. It looks like our cameras held up. They didn't catch on fire.
Didn't blow up.
So that's good. Well, I guess we'll
show.
have them for the next episode.
Good show.
This podcast was produced by T-Door Productions. Theme song written and recorded by Neil Hathaway. Vocals by Terry Work. Sound effects provided by freesfx.com and zapsplat.com.